greatest need to get the greatest amount of support. But you can't ignore the fact that New South Wales has received significant additional support. We don't begrudge them that, but we are now in a set of rules here in Victoria with case numbers too high to be able to safely open up, and that means that we have many challenges as well. And it's only fair that we distribute vaccines based on the population share and need, of course. But we can't continue to see hundreds of thousands of extra doses pouring into Sydney at the expense of every other part of our nation. We've done that. That was the right thing to do, but there has to be a limit to that, and I'm very pleased that the Prime Minister has confirmed that that won't be the case when it comes to the next allocation of any vaccines that come here earlier than planned, and or even those that are scheduled to come in September, October and indeed beyond that. Now, as you can see, we are joined today by a number of very prominent community leaders, and I want to thank them for being here with us today and for the work that they do every day to drive everyone to follow the rules, to provide care and support to so many people. I just want to read through the list of people who are with us, then I'll throw to Jerome, and then we'll hear from a couple of our guests. So Nathan Burke is here as the AFL legend and an AFLW coach here at the Bulldogs. Dr Amruha Hussain, who's a community GP who lives in Hume but has practice in Airport West, and Nathan and Dr Hussain are going to speak to us about their experience in recent times, and they're going to, I think, reinforce some messages to the community, the very proud community of the North and the West. Dr Mukesh Haikwal, who is very well known to all of us, both in his role as a former head of the AMA, but also someone who's doing just an amazing job at his clinic, providing safe access to vaccines and a really confident environment for people to come forward and play their part in bringing this pandemic to an end. He's a great Victorian and someone who I haven't seen for a while, but it's very good to see him here today. To Councillor Jonathan Marsden, the Mayor of Hobsons Bay, and local government is such an important partner for us. We can't do this on our own. We all have to work together, and we thank, through Mayor Marsden, we thank him for his support in this local community and indeed all of our local government partners. Ilch Michovsky is here as well on behalf of the Altona traders. And again, partnerships are so important, not just with different parts of government or different parts of service delivery, but also those who are out there serving customers, employing people, driving investment, so important, and we thank him for being here today as well. Now, very importantly, because we do know that there have been many families of all different faiths, but certainly in recent outbreaks we've seen families of the Islamic faith that have been touched by this, and I want to thank Islamic community leaders, both at schools and more formally as faith leaders, those who have stood up and done such an amazing job. When we think about the Al Taqwa outbreak, we had 100% of all of those kids were tested, family members tested. Amazing. We got support to all of them, and we were able to run that outbreak to ground relatively quickly. We thank everybody from that community and all communities in our multiculturalism and in our multi-faith nature of our community. You can't get this job done unless you have support from everybody involved. So it is a great honour to welcome both Sheikh Abda Musa and Sheikh Nawaz, and finally, can I thank Kashif Bunz, the General Manager of the Western Bulldogs Community Foundation, for having us here today. Of our close to 800 active cases, about 500 of them are in the North and the West. Now, that's not to single out the North and the West, but it is to make the point. The numbers don't lie. That is where the cases are, and that's where the extra effort has to be. So everybody's got to follow all the rules all the time. Everyone who's got symptoms across the board, but most particularly in the North and the West because of the volume of cases, you've got to come forward and get tested as soon as you register those symptoms. As soon as they become obvious to you, you've got to come forward and get tested. We will take care of you and your loved ones. Hopefully you're negative, but even then, you've played your part. You've played your part in making sure that you're not spreading this virus. The rules apply to everyone across the board, but we've got to have an extra special effort in the North and the West. Proud communities, brilliant communities, but this is where the virus is, and this is where our focus needs to be, of course. But we can't do it on our own, and to all of those that I've just read out, and so many more, we're deeply grateful for the partnerships we have with you, for the way in which you use the trusted position that you have in the community to promote messages and behaviour that keeps us safe. Nothing's more important than that. So, sadly, with these sorts of numbers, it's only fair that we be as upfront as possible and we make it clear to the community that we will not be able to open up and take all these rules off in just a few days' time. We will get advice in coming days. Decisions will be made and they'll be announced very soon thereafter, as we always have done. These are difficult numbers, but if you look to the experience in, say, New South Wales at the moment, I'm sure there are many thousands of nurses, many thousands of doctors who are struggling with the fact that they will very soon, it would seem, have 1,000 patients in hospital. We can avoid that. We have avoided that to this point, and we are determined to do that again. I know there is pain and there is challenge and it's tough, but this getting out of hand, completely out of hand, is so much harder, so much harder. Now, I'll ask Jerome to speak to that outbreak map, as it were, and then Nathan and Dr. Hussain are going to speak, and then we'll take any and all questions you have. Thanks very much.
Thank you, Premier, and good morning. Great to be here at the Whitton Oval. And my thanks in particular to the community leaders that have joined us here today and their unstinting efforts over the recent weeks to support the wider community in dealing with the outbreak that we have on our hands. As the Premier has said, there are 93 new cases of coronavirus in the state today. One of those is in hotel quarantine. That's 92 community cases and a total of 773 active cases of COVID in the community today. We have 44 Victorians currently in hospital. 13 of those are in ICU and 9 of those are on a ventilator. And we send our very best wishes to everybody who's recovering from coronavirus here in Victoria and indeed across Australia. Of the cases today, 61 of the 92 cases, 61 are clearly linked. 63 are clearly linked, and 29 are still under investigation. And we expect to resolve them later during the course of today. A lot of cases came in on the run late last night. Of the 92 cases, 9 are part of our wider Shepparton outbreak. 12 are in the Broadmeadows area, that Broadmeadows My Centre cluster. 12 are associated and linked into the wider Newport cluster. 9 are associated with household contacts from our earlier schools outbreaks, and we still have some ongoing transmission within family households. So 9 of those cases associated with Glenroe West Primary and Altaqua College and Elim College. We have 4 cases associated with the Woolworths at Miller Junction in Altona North, an exposure site we mentioned a few days ago. We have 1 case in an apartment building on Flinders Street where we have seen a previous case, and that's really come through our extensive Tier 2 testing program that's been ongoing. And we have 1 further case at the Port Melbourne site that we discussed yesterday. That makes 48 of the cases today. In addition, we have 15 cases that are linked to previously identified cases in recent days, so household contacts, primary close contacts to individual cases, and there are 29 cases still under investigation. As the Premier's indicated, I can certainly confirm that of the cases today, again, over 2/3 are associated within our northern and western suburbs, and that is by far the largest concentration of cases we have outside of the Shepparton area. We think and we know there are multiple chains of transmission taking place that give us those roughly 500 cases, and our thanks to everybody, the large number of primary close contacts who are isolating in those areas and the thousands of volunteers who are supporting them with providing welfare and food and other forms of relief. We have in total 16,800 primary close contacts across our outbreaks and over 20,000 secondary close contacts who are isolating with them. The age profile of our positive cases continues to be very young. We have 300 people under the age of 20 in our 773 active cases. So 171 people under the age of 10 and 131 in their teens, between 10 and 19. Similarly, we have 300 people between the ages of 20 and 39. So the vast majority of our cases continue to be amongst the younger members of our society. And I particularly appeal to those people in their 20s and 30s. This virus is very active in your age group at this point in time, and we know that many of the people in that age group, particularly permitted workers, authorised workers, please, we ask you to be very mindful of any symptoms you may have and any contact exposure sites that you might have. In terms of our key clusters of activity, in Shepparton we now have 94 cases in total, and we have across 37 different households. We have now completed over 1,300 tests yesterday. That's 23,000 tests completed in Shepparton during the course of this outbreak. I'm also pleased to confirm that we've managed to downgrade 2 of the school campus sites to Tier 2 contacts, and that's released 1,000 people from being primary close contacts. We've been able to do that by the really fantastic response we've seen to testing in the Shepperton area and being able to remove those 2 campuses from our lines of investigation. We, of course, continue to see a big effort by Goulburn Valley Health. Over 500 staff are still furloughed and isolating at this point in time, and my thanks to the wider health system for providing support to ensure we can continue to provide health services in the city. We also have fantastic work by the Red Cross, and a big call out to them and their volunteers. Over 600 food relief parcels being prepared and delivered over the weekend. They've done the most fantastic job in supporting the wider Shep community. I mentioned yesterday the aged care facility in Echuca, Warfarilla. I'm pleased to confirm that we've completed over 200 tests of residents and staff, and all of those have returned in negative test results. We'll continue to provide our full support to the aged care facility, but it looks, at this point in time, under good control, and the recent wastewater sampling we've done around the facility is also indicated negative results. We have no more cases at Royal Melbourne Hospital today. That outbreak continues to be very stable, and my thanks to the RMH team for the fantastic work they do and the increasing stability of health services at the Royal Melbourne. I can also confirm that today we have a positive case in Traralgon. We do understand the linkages of this case. This individual travelled to a funeral in Melbourne, and we understand acquisition was there. This individual is being fully supported. There will, I think, be a small number of exposure sites we identify. We're having conversations again with them today, but we understand a relatively limited amount of movement in the community, and we'll continue, of course, to support the wider Traralgon community as we work through any other exposure sites. Yesterday, I also mentioned Port Melbourne as an exposure site. I'm pleased to confirm that the 4 positive cases we have there now are all staff. They're all connected to the exposure site at the car mechanics and the car wash. We have 30 primary close contacts. They've all been tested. We'll get results for them during the course of today. We'll continue to, that site continues to be closed, but my thanks to the operator and to all the staff concerned for their support in the investigation. The Premier's mentioned, of course, our real focus for activity, particularly today and over recent days, has been to support the communities across the west and northern suburbs. And again, my thanks to the literally hundreds of community leaders and others who've been involved in supporting this effort. There is support available to anybody and everybody who is currently worried about coronavirus, has had a positive test or is currently isolating. There is support available from government in terms of the isolation payments that the Premier has mentioned and the COVID-19 disaster payments, and of course various forms of business relief. But there's also extensive support provided by many community groups in terms of supporting people to isolate, food and welfare support, and any other support that people need. Please, if you're uncertain, if you don't know where to go, if you don't know where to turn for help, please contact us at the Department of Health or contact your local community group or your faith leaders for advice about how best to be supported so you can do the right thing and support, and we can, between us together, run this outbreak to ground. As the Premier said, testing numbers continue to be very strong. We have additional testing capacity set up at various places around our hotspots, and of course the vaccination programme continues to go with great guns. With that, I'm going to hand over. I'm very delighted to hand over to Nathan Burke, a Bulldogs legend and also the coach of the AFL Women's Programme. Nathan.
Thanks, Joan. Morning, everyone. I'm here as a proud member of the Bulldogs community. Through the work of our Western Bulldogs Community Foundation, we know and we see firsthand the effects of this pandemic. We know that there are individuals and families and businesses doing it extremely tough, and that's why through the Bulldogs Community Foundation programs, we're there to provide support and information. One of those information portals is a webinar we're running on Wednesday night, which Jerome is kindly coming along to support our work in the community and the people in the community. As a football coach and a father of young daughters, I know how difficult it is to keep people focused. But I just really want to say that it is so important that we remain focused at this period of time. Focused on things like, if you do have symptoms, please get tested. Don't go to friends and families' houses if the rules do not permit that. And if you're eligible, please get vaccinated. I'll be finalising my vaccination later this week. I'm sure the Western Bulldogs and Mr Premier, the Essendon supporters, would be loving going to the MCG today to see our teams compete in the finals, but unfortunately we can't. But if we all stay together, do the right things, stay focused, hopefully by the time January comes and the AFLW starts, we will have a full house of supporters here at the Vic Uni Whitten Oval to make sure that we enjoy what we love, and that is AFLW football. So thank you very much.
Hello and good morning to everybody. My name is Dr. Amruha Hussain. I live in the City of Hume and I work in the City of Moonee Valley. So where I live and work at the moment is facing a really challenging situation. We have multiple families, entire families, that are now COVID positive, a lot of them with young children, some of them pregnant women with young children. It's really important for me to send out a message to them today to say, you know, we're wishing you the best of recoveries, and we understand that you're doing it tough at the moment. I really want people to understand that it's hard enough to look after one sick child, but when there's multiple sick children and then the carers are unwell themselves, it's a really challenging time for those families. So we want to extend our support to them, and I know that they're not unique to the Northwest. I know that's happening all over Victoria. We really want to send out our support and love to them. I also want to send out our thanks to all those people who are Tier 1 isolating at the moment. Really sticking through that 14-day period makes a big difference to everyone in the community, especially someone like me, a healthcare worker. I know that all healthcare workers will join in saying thank you to those people. You are protecting healthcare workers, you are protecting the healthcare system, and it's so important what you're doing, and I know it's a difficult job, but sticking right out to that 14 days, getting that day 13 test, really protects our community. The other thing I want to point to is the amazing amount of community work that's being done in the Northwest. Community leaders from all faith groups, from council, from government, particularly from the Islamic community, we have all stepped up. We understand that we need to continue to educate, advocate and help those people who are isolating and are COVID positive. And there's been some really great linkages. I'm very thankful to Jerome for joining us on some Zoom webinars. It's been really helpful. We will continue to advocate for our communities and make sure that they stay safe and are protected. Along with that, I'd like to just keep reiterating the messages, especially as a GP. We continue to see people presenting late for testing, sitting on symptoms for 2-3 days, sometimes up to a week or 2 weeks. We really need people to present very early when they have symptoms. Even that 24 to 48 hour gap is going to mean that contact tracing is just that much more difficult. I'm really urging people, even if they're mild symptoms, to get tested and get tested early. Just to the general wider community, please, only leave home for those 5 permitted reasons. And if you're an authorised worker, a permitted worker, then I think it's incumbent on all of us to really think about all of our interactions, decide if something is really necessary. Just because something's allowed doesn't necessarily mean that it needs to be done. We want to be here to protect each other. My final message today would be it's really, really encouraging to see the big turnout for vaccines. I'm so happy that Victorians are taking up vaccination. Right now, that's the most important thing we can do, along with following public health measures. What I would like to do is, particularly to our communities in the north and west, we want you protected. We want you vaccinated. Please come out and get vaccinated. Pick up the phone, talk to your GP, go make a booking at a hub. It's really important at this time. The outbreak is in the northwest, and we want communities protected. We are working, myself and a lot of other doctors with the Muslim Health Professionals Association. We're running Zoom webinars. We're happy to take your questions about vaccination at any point in time and answer your questions in a safe space. So we really encourage the northwestern communities as well as the wider Victorian community to take up those vaccines. Thank you very much.
Thank you very much, Doctor and Coach. Thank you. I'm able to take any questions you have.
Premier, 24 days into the lockdown, is it failing? Is it working? How would you categorise the trend is going the wrong way?
It's bloody tough for everyone. It's incredibly difficult. But if you look at what's happening in Sydney, you could let this off. You could make decisions that were not backed up by health advice, and we would not have 90 cases today, 93 cases today. We'd have thousands of cases. And we know what happens then. Our health professionals, like Dr Hussain, Dr Haikawal who's here, and thousands of nurses, they become the last line of defence. And that's incredibly difficult for them. And with Delta, it's barely a fair fight. We will not vaccinate people faster than Delta will infect them. That's the challenge we have at the moment, right? Vaccinations, we're ramping up. We don't have enough vaccine and we don't have enough people vaccinated already. That will change. September, October, November. We have options that other parts of our country do not have because these numbers are relatively low. They're still too high to open up, but being able to make some changes, being able to have some easing before we get to 80% of the community double dosed, that's still an option for us. It is barely an option in some other parts of the country. So we are still going at this as hard and as strong as we can. We acted early, but I'm not here to tell people this is easy. It's not. It's bloody hard. And I wish that, you know, I had a warehouse full of vaccine and I'd get it into people's arms as quickly as possible. I don't. I can only work with what I've got. And that is a brilliant community who knows how to get this done, even though it hurts a lot. But also the notion that more vaccines are coming. And if you look at the performance this week, the amount of bookings that were made, you know, the website was overwhelmed, the phone lines were overwhelmed, despite the fact we put on hundreds of extra call takers. So I don't get this hesitancy stuff. I know there's probably pockets that we'd like to get up higher once we get more supply, but I think there's millions of Victorians who want to get vaccinated like yesterday, and the only limiting factor at the moment is how much we have. And that's why it was important yesterday to get from the Prime Minister just that clarity. If extra supply turns up, we don't want it going, you know, there's been some special consideration for Sydney, fair enough, but now it's got to be equal. And I was very pleased that that commitment was given.
With regards to that, how strong is that commitment? Because New South Wales requested and received boosted supplies when they hit about 100 cases a day, just over. Victoria's pretty much at that point. Is there a call for us to get a boost, try to get on top of it? Should we get priority for it?
Well, we did get a reasonable share of those so-called Polish doses. Obviously, New South Wales got more, but they're facing a very different set of circumstances to us. But you know, we're locked down, they're locked down, and that means that there's a lot of pain and a lot of the challenge is very real. So, you know, it was about not having a situation where there continued to be preferential treatment as if what Victorians are living through isn't real. Of course it is. So I think the best thing to do is, as these additional stocks arrive, send them out in using the fairest method. Look, if circumstances change, then you know we'd always stick to that principle of greatest need. You know, people should be supported commensurate with their needs. But you know, they've got a good head start on us now because they were given 500,000 extra doses. I'm pretty keen that we get our fair share now, and I'm sure that other state premiers would have a similar view. Yes. And it may well even be the New South Wales view that they've had enough extra support now, and now it's time to not necessarily have them streeting ahead, because the national plan is about all of us moving together. It's also not a national plan for picnics, just quietly. So the notion of giving up vaccine that could have been in Victorians' arms so that people in other states can go and have picnics, no, that's not what we're doing. What we're going to do is we're going to get it divvied up fairly. Hopefully there's extra supply comes, and hopefully we can get lots of people through Makesh's clinic, lots of people through Dr Hussain's surgery, and lots of people through the biggest and most successful network of state hubs anywhere in our nation. I'll just remind you all, we committed to do about 25% of this work. We're doing 50% of it, and we're proud to do that. As more vaccines become available to GPs and to pharmacy, Moderna as well as more Pfizer, I'm sure we're going to see those GP numbers soar also. So it's a real partnership, but we have to have supply that's equitably sent around the country, and I'm confident that that's exactly what will happen.
Just on supply that's equitably sent across the country, given there's essentially no restrictions of COVID cases, you know, in a number of states, do you think the equitable thing to do would divert their share to Victoria? We have almost 100 cases and we've been in lockdown for ages.
Yeah, now. But we all have to open up at some point, and the notion that
they're open up though.
Well, yeah, and they might have a case tomorrow. In fact, I think the Premier of West Australia is dealing with a couple of truckies at the moment. So no one's immune from this. At the end of the day, what I was keen to have confirmed was that we weren't going to continue to see hundreds of thousands more doses going to Sydney, and I've had that confirmed, and that's a good thing, I think.
The number this morning, I think it was a pretty collective sigh from Victorians to see 92. Yeah. This far into lockdown, there's no room really to go harder than what we are right now. So where are we falling over? How is this happening?
We've all got to follow these existing rules, and if we do, then we will continue to bring these cases down. At the moment, there are some people who are making choices to not necessarily follow those rules. I just appeal to them. We can't change what you did yesterday, but please make the best choices today and going forward. The other thing too, it's not a rule as such, but the only thing to do when you've got symptoms is to go and get tested. And we've made that point literally a million times, and we're going to keep making it because it makes the biggest difference.
Is that where
you can't, as Dr. Hussain said, you can't sit on symptoms for days and days. That'll just mean you infect everyone you love.
Is that where we're seeing these cases come from, though? Is it people breaking the rules, or is it people that have waited too long to get tested?
I think probably the biggest challenge. We've seen some rather well publicised examples of, jockeys doing the wrong thing. It's across the board. It's people. There are groups of people across the board who are not necessarily following all the rules all the time. But there's also something that we can do about that. All of us at a very personal level. If you have symptoms, please get tested, and please get tested today. That's, in many respects, that is the most important thing, because that means that you're out of circulation, you're not spreading it, you're not giving it to anybody else. You are playing your part in driving these numbers down, and literally, in your choices and what you do, your behaviour, you are actually physically stopping the spread of this. That's what we all have to do. Many are, but there are some people who are just presenting a bit too late. So that's why we keep reminding people, come and get tested as soon as you have any symptoms whatsoever.
And that's where we're seeing the cases come from, though. That's where some of those...
Some can be attributable to that. Some are attributable to people not following the rules. Some is also attributable to the fact that, when you start to get cases and they seed into the community, that you can't, no matter how good your contact tracing is, you can't necessarily solve every puzzle. You do have mysteries, and that means that there's virus out there that people don't actually know about. And unwittingly, and there is asymptomatic transmission. This can be very mild in some people and deadly in others. So it's a great challenge. So sadly, what I'm saying to you is it's not just one thing in one suburb and one reason. If it was, then we would deal with that on its own. It is more complex than that, and all of these decisions, all of these choices, all of these phenomena contribute to more cases.
If that's the case, then are we essentially in a position that until we reach those vaccination targets, we are going to have some form of lockdown in place then? Because, as I say, we can't go much harder than we are now. We're already a long way into it. The fatigue has clearly set in. Is that now what we're looking at? We need to hit vaccination targets to lift a lockdown?
No, I think we have options available to us with low numbers, and if we can get them even lower, we have options that are not available in other parts of the country where they are going to have to vaccinate their way out of this.
Can you define low numbers?
Well, as low as we can get them.
What's the public health team saying is a number of acceptable daily cases to ease restrictions?
No, well, that doesn't quite work that way. They will provide advice based on what's actually occurring, and then we will be able to make decisions based on that. At the moment, the numbers are too high. It's not just about numbers, though. It's about the narrative and the story behind each of those numbers. And we've gone through that, I think, many times with you. It is about where they've been in the community. Again, I'm not here today to provide public health advice or to second-guess the advice that will be provided by the Chief Health Officer, but obviously we have restrictions that come to an end formally later in the week. We're going to have to make some further decisions. These numbers are too high. We are still... The question gets asked repeatedly by me and others, are we still a chance to drive this down to very low numbers? And the answer is yes. If it wasn't, then I would be speaking to you in terms that other premiers are speaking to their communities. We are still a chance to drive this down to very low numbers and then be able to ease. Open up, we have to wait and see, but we'll have options. No one has given up on that. That is still live and real and possible. That's the advice I have as of this morning.
Back on Steph's point, what proportion of these cases are because of people who've broken the rules? What proportion of the cases are because people have waited too long to get tested?
It'll be a mixture, but I might ask Jerome. I don't know that he'll necessarily be able to give you specific examples, but he can speak to the, if you like, the tone of this and what the different patterns are. Jerome.
Thanks, Premier. So, look, in terms of the break, if we take today's numbers as a guide, 48 of those cases are all coming out through contact tracing of existing and known clusters, and we're following through, identifying people, identifying them as positives, and putting them into the right arrangements. We've got a further 15 again that are coming from cases we've seen pop up in the last few days. We're working through their social contacts, their primary and their secondary close contacts, and to the point that that Dr. Jose made earlier. Where people present later, that means there are more people in their primary close contacts and secondary close contacts that are already infected. And that's why we see these numbers keep bleeding out. So late presentation of cases is a significant challenge to us, because then every person we find as positive has already infected their close contacts and sometimes their secondary close contacts. So that's why these numbers keep growing day after day after day. We then have 29 cases today that are under investigation. They dropped last night after around 5, 6 o'clock, so we've got work to do during the course of today and this morning and today to work out how they're linked. Some of them will be brand new cases, mystery cases where we do not understand where they acquired it from. Most of them are very geographically quite specific, so we're not seeing cases in, by and large, in unknown parts of Victoria, but we are seeing them come up where we don't have the exact links. Those are always a concern for us, because it means more detective work is necessary to say, well, how did the virus get to you? And in some of those 29, absolutely, there'll be cases of people who have either not come forward as quickly as we would have liked to have done, or who have been in contact with other people, and that information hasn't been made available to us until we find them as positives.
We've been in this COVID has been around essentially for more than 18 months now, and the very consistent messaging has been, if you have symptoms, go get tested at the earliest onset, follow the rules, don't, go visit people in their homes. How can we get through to these people who haven't got the message over the last 18 months?
Look, I think that's one of the reasons we stand up in now various places around the state every single day, and that's one of the reasons why we work so closely with community leaders and sporting leaders, and frankly anybody who we can engage with to get the messages out in different ways. Because look, we know that there's not many people watching these broadcasts live. I would expect there's not many people reading all of our mainstream media or watching the news in the evenings. We need to get the message out in new and different ways through a whole range of different networks, because this is something that people are tired of. We get that. We also know that for many people, there's a fear of getting COVID. There's a very legitimate public health fear that says, I don't want to get this. I don't want to acknowledge that I've got this. But there's also people worried about, well, how do I keep working if I've got COVID? If I get a test and I turn positive, I'm going to lose work. That's why the payments are in place. That's why there's a $450 test payment. That's why there's a $1,500 isolation payment. That's why there's other financial support available. And there's an issue around, I think, recognition across all of our communities that this is real, and this is something which is still within our control. The numbers today are not great. They're not as good as the numbers we had yesterday. They're not as good as the numbers we saw a week ago. But it's still within our hands. If we as a community want to get this down, then we can do that by isolating, by getting tested, and by getting the support we need to do those things properly.
One of the things we did last year that the government characterised as a success was going door knocking and doing testing in the northern suburbs where, it was the epicentre of the virus. Is that something that's part of your consideration, and would it be useful at this stage?
Now, look, I think we've got, we're setting up, or we have set up over the last few weeks, we continue to operate even today, multiple pop-up sites, particularly in community facilities. So today I think we're at the Newport Community Centre. We have a pop-up testing site available there. We've run pop-up testing sites with some of our mosques, with some of our church leaders. So we will continue to do that. We will put our testing stations where people feel comfortable to come forward and get tested. This is the western suburbs and the northern suburbs is a huge swathe of Melbourne. We've got 1.5 to 2 million people living across that part of our city. So these are still small numbers, but they are geographically clustered, and we need people at our local level to start to really think about, do I want to stop this now? How do I support my mum, my dad, my brother, my sister to go and get tested? And how do we deal with this together? That's the real challenge for us today.
Pop-up sites. Have you tried to, with the Sunshine West wastewater, since August 8, that's been pinging.
Right.
Have you thought of putting a pop-up testing site in that industrial estate to encourage that small group?
We put one there about 2 weeks ago, Paul. So we put one there. We've taken hundreds of people through that pop-up testing site from Ozpost, and there's about 110 businesses, I think, in that particular area that have been trooping through both that testing centre and the other bigger centres we have in the wider region. We've now narrowed it down to 47 businesses, mainly very small businesses in one corner of that estate. We're starting to home in on where we think the source of this is. I think we're getting close, and we'll hopefully have a result on that in the next few days.
Do you have a percentage split with today's numbers of 92 of how many are vaccinated, fully vaccinated?
I don't have that number now, but look, we know in terms of the hospitalisation numbers, the numbers continue to be one that where of the 44 Victorians in hospital, my understanding is only one has had one dose of vaccine so far. And the age profile, you know, we've got infants, we've got people in their 20s, 30s, 40s, 50s, etc. So we can absolutely see, and you can see it even more so in Sydney, you can see the impact the vaccine has had in terms of the age profile of who is going to hospital with it. So it does protect you. Get vaccinated, and it reduces your risk of getting the virus, it reduces your risk of passing it on, it absolutely reduces your risk of going to hospital.
Are you aware of a positive case at the Edith Vale level crossing facility?
I am, yeah.
What can you tell us about that?
There's a positive case at the Edith Vale level crossing facility. We have somebody who we understand is well connected. We understand the connections of this individual into through a number of social networks, and that's where we believe that the route of transmission has been. This individual has worked on that particular project. We've done the usual tier 1, tier 2 contact tracing of other employees at that site. That particular constructor has had a very robust process in place of health checks and workforce cohorts, so the numbers are quite small, but obviously we'll watch that very closely. So far in this outbreak, we've seen relatively limited transmission at work sites. This has been much more an outbreak of schools in the first phase, and then households, transmission happening through households. Obviously, but I would call out, and great to have Ilch here today, workplaces are really important locations. They're really important, really high-risk opportunities, particularly for those workplaces that are still open for onward transmission. So that's why we continue to encourage employers, please, make sure all those good practices are in place. You do not want COVID getting into your workplace and all the knock-on consequences of that.
So is Edith Vale level 1, level 2?
I think I don't have the full details in my head, Paul, but certainly there's a part of that site based on the immediate workforce that individual worked with who are tier 1 contacts. They'll be doing their 14 days of isolation and regular testing. Some of the other colleagues will be on a tier 2 and they'll have completed their testing.
On vaccination, the St Kilda No Booking site has been incredibly popular.
Yep.
I understand today's its last day. Would you consider extending that?
The St Kilda Peanut Farm, as it's called, has been really popular. 700 or so vaccinations a day at that location. We are looking at options to extend it, and if the demand continues to be there, then we'll keep it going.
So will it be there tomorrow morning?
We'll confirm that in the chair release this afternoon, but we are looking at that.
Have compliance activities stepped up across the west and the north?
They have. So yesterday, we did over 1,600 compliance checks yesterday, about 1,600 the day before as well. So we're seeing a lot of our colleagues out there, authorised officer colleagues and other support agencies out there, and their primary function is to check in on people who are doing that hard isolation protocol, who are doing that 14 days of isolation. They're there to make sure that people are okay, that they're healthy, that they're getting the food and the support and the welfare relief that they need, and they're doing the thing they're supposed to be doing. And again, the compliance rates have been phenomenal. You know, 99% plus of people are doing the right things. They're staying home, they're isolating, and we thank them for doing it.
And in general, when you have these cases popping up where they have waited a week or so, how much are you finding that they have been circulating in that time, and how much are you finding that they should have actually been in quarantine?
So what we do find, particularly when, as Dr. Hussain has said, when people present late for testing, it means that they will have exposed more people, because when you become, and actually Dr. Mukesh or Dr. Hussain are a better place to speak about this than I am. I'm not a clinician, as you all know. But when you feel symptoms, you're already infectious, and you have been infectious for a number of days. So when you feel symptomatic, that's not the start of the problem. That's already the midway past the problem. You've already been infectious for a number of days, which is why it's so important to get tested immediately so we can work back with you and protect the people you've already exposed yourself to. We are, of course, so the longer you wait, the more people you've been exposed to, the more people we have to trace and follow on, and the more risk that the people you've been exposed to have already exposed other people. So the problem just grows and grows and grows. That's why testing early is the single most important thing.
You might not have the breakdown at the moment, but in this afternoon's show release, can we get a proportion of people who transmitted the virus by breaking rules or not getting tested early enough?
I can't do it quite that simply. I understand the question you're asking, Samaya. We'll give it a shot. Might not be in the release this afternoon. We're quite busy today, but we'll give it a go.
No worries. And given Pfizer's now opened up to everybody, the north and the west, they've been particularly hit hard over the past 2 years. Vaccination rates rates there are relatively low. It has a younger population as well. Have we considered diverting vaccines Pfizer to Melbourne's north and west?
Yeah, look, we've certainly we've got 22 state clinics. 22 of our 50+ state clinics are in the west, in the north, and in the southeast of Melbourne, and all locations where we're seeing lower levels of current first dose vaccination, primarily because they're younger cohorts. They're younger families living in those areas compared to the rest of Melbourne and Victoria as a whole. So in the state system, we boost additional vaccines to those places where there are lower levels of vaccination, number one, and number two, where there are fewer GP practices or there's fewer penetration of GPs into the network. So, you know, compared to the eastern suburbs, we see, generally speaking, fewer GP practices in the west. That's why we have more state clinics in the west. That's why we put more doses into the west in those big hubs like the Showgrounds, Melton, the Eagle Stadium at Werribee, Sunshine Hospital. So they're doing a heavy lifting. But of course, it's also critically important that we continue to support the hardworking GPs in those areas. They're carrying the lion's share of the vaccination program, and we continue to do all we can at state and federal level to make sure they get the support they need.
Jerome, it's been 2 weeks now since that pub crawl in Richmond. Has there been any evidence of community transmission that's come from that?
No, we've not seen any direct evidence of any cases coming in from that, and I think, you know, it was clearly a regrettable event, but across a number of other regrettable events that we've seen over the course of this outbreak. We've certainly seen some cases in that St Kilda East area. We've seen some cases in the inner north. We haven't seen any clear associations with the pub crawl.
The vaccination message seems to not be getting to a few LGAs specifically, Hume, Whittlesea, Melbourne, Darebin. What's happening there?
No, I think they are getting through, Paul. I think
I'm just saying that they've got the lowest rates.
Sure, they've got the lowest rates, and I think, as I said earlier, part of that is because it's a younger age profile of people who live in those LGAs compared to other parts of Melbourne. It's only been, a week or so since we've opened up access to 16 to 39-year-olds for mainstream Pfizer vaccination. We've seen a massive surge of support. The vaccination centres I've mentioned that we have in the West are doing over 4,000 doses a day through those big vaccination centres. So we're seeing a big and enthusiastic uptake in the West and in the North for vaccination. The challenge for us right now is we've booked out all the supply we've got now. We need more supply to keep that vaccination programme going. I know that the GP practices can do more vaccination. I know our state centres can do more vaccination. We just need to supply in order to do it.
But those LGAs are at the bottom of the list because of the age profile?
No, well, but a combination of things, and I think we've gone to that in previous conferences. So it's a combination of age profiles. So we've got younger families living in those LGAs compared to other parts of Melbourne. That frankly has been the primary reason why we've got lower uptake. I expect to see over the coming days, over the coming weeks, if we continue to see, if the doses keep arriving, those numbers will balance out pretty quickly.
Not sure if this is one for you or the Premier, Jerome, but
Probably the Premier.
In yesterday's CHO release, there was a new rule brought in for Year 12 students who need to perform as part of their school-based assessments, and they have to get tested ideally before or within, I think it was 48 hours of that.
That's right.
Can you just explain that? This has come as a surprise to schools this morning.
I can, and look, apologies, obviously I'm not an education specialist either, but in terms of the arrangements we have in place, there are a number of SACs that are due, which are the performing arts SACs, so music and dance and those sort of things. We're working very hard to ensure that children can continue to take their SACs. So I've got a Year 12 student at home myself. He's doing his SACs online. For those performing SACs, we are asking students to take a test beforehand, 48 hours beforehand, through any of our 200+ testing centres to make sure they clear a negative test. I would be, obviously appreciate the work that the schools will do. It's a relatively small number of students who take those performing arts SACs. I would ask the schools, of course, that in recognition of us allowing those SACs to go ahead as planned, please check that the children have got their negative test results on their phone or whatever other evidence you want to use to make sure that they're safe to come in and get that SAC done.
Are we asking them to do that, or are we mandating that?
Look, it's a very clear understanding, and we're working through the education department to ensure the schools understand what they need to do. Our very strong expectation is that schools will be checking that for those children coming in for their performing arts SACs, that they've cleared a negative test. We're running over 50,000 tests a day. The test results are coming back 99% of the time by the next day. The queues and the waiting times are not excessively long, so we just ask parents and those Year 11 and 12 students on the performing SACs only, if you've got one of those due, get tested a couple of days before, get your negative test result, and you can go and do the SAC with confidence, and we wish you all the best with it.
And on that front, are we any closer to having a plan for vaccinating our Year 12s as well and giving them priority?
No. There's some work being done at the moment across ourselves and across with our Commonwealth colleagues. Obviously, we need additional vaccine supply to ensure we can get Year 12 and the rest of Victorians vaccinated, but no other announcements to make today.
Of the kids in hospital, how many are there, and also how ill are they, obviously, without breaching their privacy?
Yeah, I think at this point in time, I haven't checked in the last 24 hours, Samaya, but my understanding is there's still one infant in hospital who's not in ICU.
And there's been an infant in hospital for a while now. Is it the same infant or is it a different infant? And are they ill themselves, or are they in hospital because their parents are tested?
So I can confirm there is an infant in hospital. I'm not going to give any more details on that, I'm afraid.
And can you just quickly clarify how many cases were infectious in the community in today's numbers?
So we don't have a detailed number on that yet. I've got confirmation that 19 of today's cases were in full isolation for their infectious period, largely coming out of those established primary close contact hubs. We're still working through a number of the other cases, so we'll do an update in the show release.
And this may be one for the Premier again, but what about regional Victoria? We always ask you, but people outside of Shepparton will be wondering, any hope of them seeing eased restrictions before Melbourne?
Look, we will take the best public health advice from the Chief Health Officer, and if there are things we can ease in regional Victoria, if there are decisions we can make that return some freedoms to people, whether they be in regional Victoria or across the whole state, then of course we will follow that advice. I wish these numbers were lower. I wish I had a warehouse full of vaccines, because it wouldn't be full for long. We would get it into people's arms as fast as possible. But we can't pretend that things are different. These are the realities that we face. They're very challenging. This is bloody tough for business, for families, for all of us. But there is no alternative, and that is why there is a national plan that's been signed up to by every single leader, regardless of political party, regardless of the level of government, regardless of your point of view on many things. We've all signed up to a national plan, and it is a recognition that we do not have enough people vaccinated now in order to open up and let this run. If we do, we will just have thousands and thousands of people from no family would be left untouched. We would finish up with thousands of people in hospital. And that's just not fair on our nurses, and it's not fair on those in the community who've got pre-existing health conditions, and indeed healthy people, because this will infect people of all ages, of all backgrounds. Whether we like it or not, we are all in this together. Just don't ever doubt that. We are all in this together, and we all need to look out for each other and make good decisions based on the best health advice. I wish it were another way. I wish there were 5 other options, and they're all easy, because we would choose them. But we simply don't have any other option at this point. If we can continue to drive down cases, if we can, and our contact tracers are doing an amazing job. This is about avoiding what's happening in Sydney, but it's also about keeping alive a number of options. And they are still there. They are still within reach. But we can't do this on our own. We need every single Victorian to get tested the moment they have symptoms. And then we need people to follow these rules, follow all the rules all of the time, and we will get these case numbers down further. How quickly we can do that and what that will make possible, we'll have more to say about that later in the week when the advice comes through based on what's actually occurring. But if we can open up regional Victoria or give to regional Victoria greater freedoms, of course we will.
Just to clarify, sorry Simone, just to clarify on that point about 70% and reopening, is the plan at 70%, which is a couple of months away, to is it to allow those? What's the plan at 70%? Will it proceed to ease up despite the case numbers?
Well, once you get to 70% double dose, but more importantly, frankly, 80%, 70% is a marker, but the really significant shifts don't occur until you get to the 80%. And indeed, hopefully we can go beyond that, as every extra dose helps. Ultimately, what we're going to move to is a pandemic that's applicable to everybody. It's going to move to a pandemic of the unvaccinated. The smaller the unvaccinated group is, the more manageable, from a health service point of view, those inevitable positive cases will be, and very serious illness. Look around the rest of the world. That is every reason to get vaccinated. At the moment we don't have enough, but that will change soon. And then everyone needs to go and get vaccinated. There's just no alternative. And it's not only is it a good choice for you, but it's a good choice for all of us, because not if, but when the health system comes under enormous pressure, COVID's not the only thing that hospitals deal with. They have to deal with serious accidents. They have to deal with strokes, heart attacks, cancer, premature babies. They have to deal with everything and everyone. And if our hospitals finish up full of unvaccinated people who've made the wrong choice, unvaccinated people who could have been vaccinated, well, then there'll be a lot of other people who, from a COVID point of view, did the right thing and went and got their 2 doses, who won't be able to get the care that they need.
I'm just trying to clarify, though, if it's 70...
So it's 70% you can ease in some areas. 80% is when there's really significant change. And yes, we do move away from every single case matters to the point of, we're being obsessively focused on every single one. We move much more to a system that's about trying to balance and preserve sufficient capacity in the hospital. So hospitalisations become, in many respects, a more meaningful measure.
But the changes
But only when you've got the safety net of having 8 out of 10 eligible people having been through the vaccination system.
So changes are triggered at 70 despite case numbers?
Yeah, the national plan's very clear. When you get to 70, you've got more options. There are things you can do you can't do now. Lockdowns are not impossible, but they're less likely. That's the wording I think that is used. At 80%, well, you wouldn't be locking down the whole community to keep safe those who wouldn't keep themselves safe by going and getting vaccinated.
And borders reopening, 70 or 80?
Not necessarily, because I think you might find that this is the frustrating thing, right? You can have a national plan, it can be backed up by modelling, it can be, a tome of a thing, right? But it will depend on what's happening at that time. And if we get to a situation where, it ran rife through an unvaccinated community and we literally had thousands of people in hospital, well, then we would have to look at that. You can't just pretend that isn't happening. And that'll be the really challenging part. How do you balance opening up, giving people freedom that will promote infection? And if you've got too few people vaccinated at that point or too few vulnerable people, I think you understand the point I'm making, then you will finish up with many, many people very ill and they will finish up in hospital. And these are these terrible scenes we see from the US, for instance, where people are in ICU begging to be vaccinated and they have to be told, no, it's too late. It's way too... We would have that here right now if we opened up. We would have so many people in hospital. It would be unmanageable. 70% gives us some options. 80% is the really important marker. And I know it's only 10 points between the two, but 80% in all the modelling is much more meaningful in terms of a sort of a safety net, if you like. Now, on top of that, just this week, to the question earlier about schools, just this week we had announcements made about Otago having approved, I think TGA having approved 12 to 15-year-olds. They're not included in that 70 and 80%. If we can get them done, at least single dose by the end of the year, the end of the school year, as we plan to do, that again gives us even more protection. Not ultimate protection, but it adds. Every single dose, every single person through the vaccination program will matter. Because the smaller that unvaccinated group is, the more manageable the pandemic that will occur, the sort of the second pandemic almost, within that group, the more manageable it will be for our nurses and our AMBOs and for all of us.
Sorry, Emma. On our current lockdown, now that the September 2nd date has been rubbed out, can we anticipate getting another date or is it just open-ended now?
No, we'll have more to say before Thursday about what the new restrictions look like and we'll get advice. We'll get advice from the Chief Health Officer in the next couple of days and we'll make those decisions and then we'll make those announcements. And if there are some things we can do that are safe, then of course we will. We get that advice. If not, we will all have to find a way, find it in ourselves to push on and continue to throw everything we've got at trying to drive these numbers down. Not from ideology, not from some theory, but just from the practical reality that if you opened up now, it'll get away from us completely and utterly and we will have our hospitals full. And the Delta variant will infect more people faster than we can vaccinate people. And then it's not manageable. It just gets away from you. And I know what it's like because I've spoken to nurses and doctors and others in the health system from what it was like last year with 400, 500, 600 patients in hospital. You start having thousands of people in hospital, it is horrendous. absolutely horrendous. Now, if we had another option, we'd choose it. We don't. But there will be dates associated with all the announcements we make later in the week. I'm just being upfront with people. And I think people, it's not exactly a news flash. Like, if you've got nearly 100 cases today, we're not going to drive that down to zero or to very low numbers, and they're all isolating away for us to safely be able to have big changes to the rules on in just a couple of days' time. But I'm being clear with people that we're not going to be able to open the place up in just a few days.
And as part of the chose, I guess, sorry, I just lost
It's
my
all right,
train
it's fine.
of thought.
It happens to the best of us. It happens to the best of us.
As part of the chose considerations to extend lockdown beyond Thursday, is he looking at tightening the restrictions? You said he's looking at if we can ease some restrictions, like, you know, is the curfew on the card? What kind of things is he looking at to make it more manageable?
I'm not foreshadowing that there'll be any easing on Thursday. I'm not foreshadowing that there'll be massive changes. I'm being pretty clear with people that these numbers are too high, and there is no chance of me getting advice from the Chief Health Officer in the next couple of days to make big sweeping changes to these rules. However, everything is on the table. We look at everything. He will look, and his team will look at all of the rules that are on, and in the current circumstances, with not a theory, not a model, but the actual cases and what's occurring each and every day, he will make the very difficult judgments to balance up all the competing needs, the needs of business, the needs of people from a mental health and wellbeing point of view, and of course our bigger imperative, the broader imperative, that's not a choice, it's what we just have to deal with, the fact that this thing is wildly infectious and will run and run hard if we don't have rules on. He will balance all that up, he will provide advice to Cabinet, we'll make a decision, and I'll be out to announce it very soon thereafter.
And is he also considering, like, VCE students, for example, returning back to the classroom, childcare, kindergarten?
Yeah,
like, what are some of these things?
He considers all of those things. He considers all of those things and more. And no Victorian should be in any doubt. None of these decisions are taken lightly. None of these decisions are flippantly made. It is a process of very important consideration, deliberation, and these decisions weigh heavily on the Chief Health Officer and his team. It's not easy to make some of the decisions that he's had to make, but what's the alternative? And this is the thing I keep, as respectfully as I can, people can have different views, absolutely, that's fine. But at some point it's incumbent upon those who are critics from the sidelines and those who've got an opinion on everything, well, what's your plan? What's your alternative? And there isn't one. And that's why there's a national plan agreed by all of us. And, you know, we're all elected leaders of governments. And some might say that's, you know, we don't have too many things in common beyond that. We have very different worldviews. We come from different parts of the country. We come from different political parties. But we've all got advice that this is our only way forward. And that's why we've agreed to this national plan.
Can you give Victorians and Victorian businesses particularly an assurance that, are they going to hear on Tuesday? Are they going to hear on Wednesday? What day will we?
Well, I think I've made it very clear that it's not like people are going to need notice to be opening up. So I've made it very clear that these rules are not going to be fundamentally changing. So notice is important, yes, but it's always more important, I think, when you are moving out, as it were, because people have to get ready for that. We'll get the advice to people as soon as we possibly can. We usually wait to get the most complete picture, so it's not going to be tomorrow, but it will be as soon as possible, and we'll balance up getting as much data and being as close to the deadline, if you like. But there'll be further announcements. I wasn't going to stand here today and try and tell people what they all know to be, you know, tell them the opposite of what they know to be true. These numbers are too high, and they're not going to miraculously fall over the next 2 or 3 days. This is a long, hard fight. It's incredibly tough. It's incredibly difficult, but it's our only option. And if there were another option, well, not just me, but every leader in the country would choose it. So if there's any doubt about that, this is literally every Premier, Chief Minister and the Prime Minister signed up to a plan to get us vaccinated and to get us open and to get us past this. But none of that happens in an instant, I'm afraid. As I said to you, if I had a warehouse full of Pfizer, Moderna, whatever it was, it wouldn't be full for long. We'd have it in people's arms.
Last weekend you spoke about concerns about the protest that was on Saturday. Thousands of people there, you expressed concerns that it could potentially spread the virus. Is there any indication that that happened?
Not that I'm aware of, no.
Does that surprise you?
Not really. I don't know that. Well, I'll put it to you this way: if you've got a bunch of people who don't necessarily think COVID's real, I don't think they're going to be standing in the queue getting a test, are they? So, like, it just stands to reason. It was appalling for a number of reasons. One, it may well have contributed to the numbers we're reporting today. It may well have. Sometimes you won't know. Mystery cases are just that. They are a mystery. We can't work out exactly where it came from. It was also appalling for the absolutely disgusting way in which some people behaved. It's just never appropriate to be violent towards law enforcement. Police do an amazing job, a tough job, and it's hard enough without that sort of conduct. And that's why when the Chief Commissioner says that the book will be thrown at these people, I believe him. It will be. And I think Victoria Police are asking anyone who knows any of the people that have been featured in the media, and thank you for the work you've done to do that, and they should contact Crime Stoppers and help police track them down.
Looking well ahead, there's reports today that the Grand Prix is going to be held in April next year. April 10, I think, was the date. Is that a discussion?
That is looking well and truly ahead. We could absolutely agree on that. It's a long way off.
Is that a discussion you've had in any way, shape or form as yet?
I've had lots of discussions about that event, lots of discussions about lots of major events, but I have no announcements to make today about any major events. But look, next year we have, obviously, we get to 70, we get to 80, hopefully we get beyond 80%. We've got our kids through that vaccine program, certainly 12 and up. We've got options. We've got many options to do many different things. As we just heard before, we can, all of us with a sense of hope and optimism and confidence, we can look to the back end of this year and into next year. We're in a very different set of circumstances. We are vaccinated at those record high levels. That gives us protection. It's not absolute, but it gives us protection, and it means that we can manage the health system and the health outcome, and we can then start the process of booster shots, which will be, quite a big thing to do also. All these things, all these options, all our freedoms and a sense of normality are predicated on us getting people through the vaccination program. That's why no one should be hesitant. They're safe, they work, they save lives, and they allow us to open up. I only wish we had more of them. I don't. I can only get what's given to me into people's arms as fast as possible, and I think Victorians are doing a mighty job at that, and we can be proud. It sounds odd, but I was pleased to see the website under absolute pressure. I was pleased to see the phone lines under pressure. We boosted them, but when you see so much demand, that's a good thing. That's a very, very good thing to see so many people wanting to be part of this program. We thought that would be the case, but you always want to see it, and we absolutely have. And if we had another 400, 500, 600, another 1 million doses this week, we would get them out the door.
If you're looking for another incentive, would it be, or do you envisage, I suppose, that big events like a Grand Prix will be only for those vaccinated?
Well, there's some work being done by National Cabinet, and as part of that conversation with the Prime Minister yesterday, I think we'll have some further discussions this week, he and I, about how some of those things can work. I think that it is a restaurant or a major event that is only attended by people that are double vaccinated is always going to be a safer event and going to contribute less to people being in hospital. So I think the time is coming where your vaccination status will matter. You've already seen airlines, the other airlines in terms of flights. The other thing too is, like, anyone who thinks they're going to be travelling around the world without having been vaccinated, like, your vaccination status is going to be a thing. You're not getting a visa unless you have been double dosed. And whether people like that or it's a terrible attack on their civil liberties, like, people die when they get this. So there are limits on choices that are made that they're not your choices in many ways. I mean that in the absolute literal sense. They're choices that affect you, yes, but they're made by you, but they affect so many others. And that's where that difficult balance has to come forward. And that's why we have mandated some people. So, for instance, aged care workers, private aged care workers, public aged care workers, they have to get they have to be part of the vaccine program. And if you're working in public aged care and you haven't been vaccinated, that's about, 15, 18% of the workforce. They're not being rostered on at the moment. So these are all very challenging things, and they test all of us because it's not the normal way we operate, but that's the nature of a 1 in 100 year event.
On a slightly lighter note, Premier.
Directly to the community today with the leaders here. Will we be able to hear from the Chief Psychiatrist at one of these forums to speak directly to the people as well?
Sure. Yep, sure. We've had people from the mental health part of the Department of Health at briefings before. Dr. Coventry can come and speak. There's no problem with that at all. I think I do just want to make the point, though, that I wouldn't want anyone to think that there wasn't massive effort gone into bolstering and supporting those who provide mental health care across the board, whether it's counselling services all the way through to those who are acutely unwell. We have doubled our efforts, redoubled them. We understand that there is a big impact, and it would just be wrong for anyone to assume that we weren't aware of that and we weren't taking that into account and we weren't trying to support those who in turn provide care and support to those who have got a mental health challenge, a real well-being challenge at the moment. It's very, very real.
On a slightly lighter note, Premier, there's a businessman that runs the Commons on St Kilda Road that wants to do a like Las Vegas-style marriage and vaccination for the bride and groom and others. I guess we've got to sometimes think a bit creatively about getting people vaccinated.
Well, that would be, that's on the creative side, yes. I don't know about that. I think we'd have to get some health advice on that. Vaccines are only administered by qualified people, and we're not having weddings in Victoria at the moment. I note that there's some of that activity going on up in Sydney, but we don't believe that's safe to do now, other than for genuine, compassionate reasons. That's the advice that I have, and I'm not about to change that. Others have got different advice, it seems.
Parliament has been suspended again. Is there any reason why we haven't been able to work out a way for Parliament to sit safely or remotely?
You'd need to speak to the President or the Speaker about that. I'm a member of that forum, so I'm never going to tell you it's not important. Of course it is, absolutely, but I don't run it. Parliament's run by the Speaker and the President of the Legislative Council, and as for virtual sittings and all of that sort of stuff, that really is a matter for them.
But is this they're a part of your team at the end of the day, regardless, they're the Speaker and they're the President, but they're Labor MPs.
They're Labor MPs, but they're officers of the Parliament, and they work with the clerks and they work with all parties. And as for virtual parliamentary sittings, I would direct you to them. It is not at the top of my list, the notion of rushing to take effort away from vaccinating people so that we can have a Zoom Parliament, right? We'll make up the days. We've said that. We'll make up the days. But it's not a question for me, Samaya. It's a question with respect for the President and the Speaker, and I'm sure they're only too happy to talk to you about all the time they've got to devote to a virtual Parliament. I don't have time to do that because that's not my job. My job is many other things.
Other MPs, they've obviously raised their preferences for the way Parliament can be conducted. What's your preference?
My preference is that the Speaker and the President, who have time and indeed responsibility for these matters, get on and do whatever they need to do.
Do you think it's appropriate, though?
I know the federal Parliament's not doing this either, so this is a challenge. I think the pandemic has brought into sharp focus a number of environments where we prefer probably a different set of rules, or maybe different custom and practice, and maybe there needs to be some law reform, maybe there needs to be some change. The only reason it's not happening is it probably can't legally. But again, I'm now straying into areas that are not my responsibility.
Do you think it's appropriate, though, given there are so many bills, for example, that need to pass Parliament, so many constituency questions that are not being asked because Parliament's not sitting? We're obviously in a very strange world. We've been in one for the last 2 years.
Yeah. Well, I think if you ask Victorians whether people giving speeches on the floor of the Parliament is as important as getting jabs into the arms of people, or contact tracing, or I'm not apologising for the priorities that I've got, Samaya. I'm just not. I'm focused on keeping people well and driving these numbers down. The Parliament, you should go and speak, as I've said to you a couple of times now, with the greatest of respect. The President and the Speaker are the people to speak to.
Premier, do you have any plans to use public health orders to mandate vaccines for teachers and the health workforce?
I don't think we'll necessarily need to do that. They're not made by me. Those public health orders are made by the Chief Health Officer. If we felt that there was very low take-up, if we felt that there was a challenge, like a risk to public health, then of course you wouldn't rule it out, because in fact, as a National Cabinet, we have made decisions to mandate vaccines for aged care workers, for instance. So I couldn't rule it out, but I don't have any advice to do that now. And in fact, we're seeing those numbers I read out before, so 60 to 69, about 80%. 70 and older, 86% have all had their first dose. The stampede, if you like, that I referred to a couple of times today this week, when we opened up from 16 to 39. Gracie our daughter got a booking. She's going to get her first dose later on today. Yeah, we just went through the system, sat there from 5 a.m. and at about 7:30 that night she got a booking. Some of her friends didn't. Many of them have got one since. I don't think that there is such a hesitancy problem that we're going to need to have to mandate this in many settings, but there may be some, and aged care is obviously one of those.
Can I ask Jerome a question?
Any more for me, guys?
I have just one more. Sorry.
Sure. No worries.
Just the Victorian opposition today are calling for a COVID compassion commissioner to try and deal with those more sensitive cases.
Yeah,
what are your thoughts on that?
The opposition are not relevant to the work that I do, and what I would say to you is that the Chief Health Officer and all the team who work on those compassionate cases that come to us, they're heartbreaking decisions, and any suggestion that they're not compassionate in the decisions they make is simply wrong and deeply offensive to those who work extremely hard to make that balance. I would just say having someone do this work who isn't in the public health team makes no sense. These are public, who comes to the state is a public, and the risks they pose is a public health decision. This is heartbreaking though. There are so many cases where we've had to say no. It is genuinely heartbreaking. That's why we all have to work as hard as we can to follow the rules to get the numbers down so we have greater options, choices and freedoms, and we've all got to go and get vaccinated as soon as the stuff arrives so that we can deal with some of these heartbreaking decisions. That's the real key here. And it's at those points that we'll no longer have to be worried about some of those things. We will have greater freedom and we'll be able to see people reunited and see people no longer locked out of their state and no longer locked into their home. That's what I'm working towards, and that's what's top all the way through to the bottom of my list. That's what's most important. Jerome, I think they have some questions for you.
And with all the doom and gloom about vaccine numbers, one of the, I guess, most heartening things has been the vaccination rates among the Indigenous population here in Victoria, almost double the rest of the Victorian population. What do you put that success down to?
Oh, look, I think it's been, as you say, fantastic to see the wonderful work of the Aboriginal communities, but also the Aboriginal controlled health organisations in just encouraging that uptake of vaccination amongst our most important communities, and they've done a wonderful job over many, many months. It also shows the importance of of time that we've had 6 months now where we've prioritised the vaccination of Aboriginal and Torres Strait Islanders. That's clearly had an effect, and I just thank everybody in those communities for coming forward and getting vaccinated. There's still more to do, and we'll keep doing it.
What's the biggest difference between us here in Victoria and the rest of the country? I think in WA only 6 or 8% of their Indigenous population has been vaccinated, and obviously there are a lot more remote communities there. Yeah,
look, I think I'm not well placed to comment on other states, but I think what we can see here is we've seen a really strong partnership between the ACCHOs, between local GPs and primary health practices and state clinics, and again we've all worked together to get vaccination into every corner of our state right from the beginning. When we started the vaccination program all the way back in February, we focused on getting outreach and services right into every corner of our state, and I think that served us well, and I think the ACCHOs are well supported, our local GPs are well supported, but we've got a big job to do over literally the days, weeks and months ahead to get to that 80% threshold for double vaccinations, and we all need to do everything we can to get that done. Okay, great. Thank you all very much. Thank you.